Good morning. I'm Virginia Litle. I'm a thoracic surgeon at Boston University Medical Center and president of the Women in Thoracic Surgery.
I'm Yolonda Colson. I am a thoracic surgeon at Brigham and Women's Hospital, Harvard Medical School.
I'm Smolens. I'm a cardiothoracic surgeon in private practice in the Phoenix, Arizona area.
I'm Meena. I'm a pediatric cardiac surgeon from Boston Children's Hospital and Harvard Medical School.
I'm Nora Burgess. I have been an adult cardiac surgeon in San Francisco at the Kaiser Permanente Medical Center and am recently retired.
So we're here this morning to address some questions about cardiothoracic surgery and the role of women in the field. And I thought we could start off with asking questions about why we chose cardiothoracic surgery as our specialty. I will answer first. I chose cardiothoracic surgery because I have a specific interest in oncologic medicine, and thoracic surgery involves a lot of cancer treatment. I also enjoyed the challenges, the operative challenges, and the anatomy, and the role of working at a medical center, academic medical center. I enjoy teaching the residents and the medical students and encouraging young trainees to go into our field. I find it very challenging, but it's always, it's never boring. There's constant problem solving, and I love my job.
So I went into it simply because I loved it. I loved every minute in the OR, and I like surgery in general, but there was something about the chest. I like the lung. That's my thing, and I like operating on it, and I like staying up. And I think you have to decide. You have 24 hours of your day, and what do you want to spend it doing? And what you do for your living should be what you really, really like to do. And if that means I'm not going to do other things, and I'm not going to be home for to do that, I could stay home with my children. But if I'm going to give up that time, I want it to be something that I really love, and that's what I really love. And it was clear to me from the first case that I did that I really wanted to do thoracic surgery, and that's what I like to do.
I had kind of a similar experience to yours. I really had no idea what I wanted to do when I was in general surgery until I hit my cardiac rotation. And so many of my fellow residents hated it, and I thought I was crazy because I really loved it. And then I went back as a more junior resident and really loved it again and kind of figured that's really what I needed to do. And I actually am lucky in some ways. I have a nice mix of adult cardiac and general thoracic, and I love being in the OR. And like you, if I have to be away from my family, I better be doing something I enjoy, and being in the operating room is it. So
I always wanted to do pediatric surgery, actually, and then I did a rotation as a second year in cardiac surgery, and I just got hooked, and I decided to combine my interest in pediatric surgery with cardiac surgery, and so here I am.
I think the easiest answer to the question is that it's the most fun thing in the world. I think that the anatomy is beautiful. I think the physiology is amazing. In cardiac surgery, you deconstruct a vascular system, do your procedures, reconstruct it, put everything back together again, and you can really turn people's lives around. Yeah. You can take people who are critically ill and they go back to living thriving lives, and that is very gratifying. So it's a balance of doing something of purpose and usefulness, as well as something that is very exciting, intellectually challenging, and very dynamic.
And I think that's something we really do forget, that we take somebody for cardiac or thoracic or esophagus that are critically ill, and you make a huge difference, which is different than a lot of other fields where I think you go around and you try, you have a medicine, you do it. This is you go in and you fix it, and I like that part of it.
I was going to say the other part of it I like too is no two cases are the same. They really aren't. Yeah. Even the most minor of cases, no two cases are the same. So every day is different.
Meena?
Yeah.
And I can't imagine doing anything else, and I think that's important. You need to be passionate about wanting to do it. Otherwise, it's just a job, not something you love to do. It cannot be.
It's easy to be passionate about it.
Yeah,
it is.
Yeah. But it is a constantly humbling field. When you think, even though I've been practicing for 10 years and I think I've seen everything, you're then reminded that you have not seen everything. So I don't know if you guys feel the same way.
Yeah, I was in practice for over 30 years, and you're always learning something new. You have you get patina, you get, some age to you. But there is a constant learning experience. There's always a learning curve. It's lifelong learning, career-long learning, and that's very intellectually satisfying.
Yeah, we should all age well because our minds are always being used. Yeah, so this is deemed a very challenging career path, and we obviously we love it, and that's why we chose to go into it. How do we manage to our work-life balance and manage to have something outside of work, family, social life?
And even doing research and things are all part of that mix. And I think part of it is you learn to be very wise in your choices. I think you have to pick the people who are around you and support you carefully, be it a spouse or be it partners or whatever. You have to have people who can help you balance that and who can step in to understand it and truly understand why it's important. So in my family, I have 2 daughters, and my husband he works in a different city to make it all work. And I think what we've really learned is that it's as much a part of their self-worth and their contribution, what I do, as it is to me. It's important to them that they somehow feel that they're making a difference in these people's lives too. And I think that's really part of that work-life balance. You have to get help, and you have to not be afraid to ask for it, and it has to be part of the whole picture.
I was not very good at maintaining balance during my residency. That was 10 years of my life where I was very unbalanced, and it was hard. And then finally, when I finished, I finally realized there's more to life than just working. I have a spouse who's incredibly supportive, but is also a physician in a different specialty. I think that helps making them very understanding. And we have a daughter, and we've raised her to kind of get it. And she's very empathetic. And in fact, I actually took her on rounds for the first time a couple of weeks ago, and she thought that was pretty cool. And she's 8, and I thought it was kind of neat to be able to show her what I do. And we also pay a lot of people to do a lot of things around the house so that I'm not spending my free time cleaning or picking up or doing any of those things, and I outsource it to a lot of different people. And that makes life easier.
Yeah, you have to be willing to accept that some of the child care is going to be done by someone that you pay for. And you may not always be there all the time, but again, if you have a supportive spouse, you can help balance, or partner who can help balance it, and be there at the field trips or attend the conferences with the teachers. You just have to accept the fact that you may not always be able to be there because, unfortunately, patients can be unpredictable, and they do take priority. But saying all that, I think we are good role models for our children. Especially, I have 1 daughter, Yolonda has 2, Iva has 1. We're role models for young women, and I'm really proud of that.
And I agree with the people of this panel that life and work balance is a little bit difficult during residency, but you're doing something you really love, so it actually doesn't matter. And once you become a young attending, you can always balance your life. You can always find time to spend with the people you love. And it's not difficult if you have good partners who are willing to help you out. And I think that should not be the reason you don't choose cardiac surgery or cardiothoracic surgery as your career choice. It should be something you love to do, and that's why you should choose it. You can always find balance if you set your mind to it.
I think that just as you're proactive in choosing your career and being sure that you're learning well during your training, you should be proactive about your personal life. I think you should look ahead, think about what you want your life to look like in the next 5 years, and go there. And that may mean that you do organize your time. I have a lot of outside activities and interests, anything from sailing to art to travel to volunteer work. And it does require some effort to balance them all out. And, I'll set aside time to spend with my husband. And it sounds a little bit more self-aware than you might think is necessary, but it really pays off occasionally to think about it and to see if you're balancing the time you have under your control, and then also working with your partners. And you can be more articulate about what you want to do if you are thinking about how to organize your time and what you want things to look like over your future. And it's totally doable. It just takes a little bit more effort, perhaps, than some other kinds of careers, but absolutely, totally feasible.
I mean, I think routine helps. Because when I was, I had young kids, it would be, we'd always try to make it so we had pancakes on Sunday morning, or we always read to the kids at night for bedtime. And we've managed, because you set up kind of this family time, you can set up those rules and those guidelines, that we've been able to do whole things as a family, you know, on a basis. So we can do kung fu, and they have their black belts, they have all that stuff, which is not maybe something you'd normally do, but I think the routine is really helpful.
I agree with that. I also think, and we talked about this before we were sitting at this table, is things have changed. And I know when I was a junior resident and even a medical student, the attendings that were cardiothoracic surgeons were in the hospital a lot more, and you really could tell that they weren't paying attention to their families. And I know I have a very supportive partner in practice, and it's equally as important to him to be there for his kids' things as it is for me. And I think socially it's much more acceptable. And so we make our schedules, even though it's a little chaotic and you might go back to work at 9 o'clock at night, you still can make it for your kids' events and do things like that. And I think it's become a little bit easier because everybody's invested in that stuff now too.
Yeah, I agree. I have it's not just unique to your practice. I feel like my partners always take time for their families when they can, obviously when there's no clinical conflict. Right. But it really has changed over what I saw during my training, and just surgery training and cardiothoracic training, how the attendings would almost have to sneak out of the hospital if they wanted to go to a soccer game. But now it's like, okay, I got to go. I got something to do with my children, and if there's nothing else, conflicting with it, then they'll do it. Right. So we're all understanding, and I think that has been an excellent change. So.
And yes, I agree with Yolanda. You can manage your time in such a way that you can go for an important event and come back and finish your work. And you're not working a 9-to-5 job, so time is yours to do as you want.
I think society has changed quite a bit, certainly since when I first went into the field, where I was challenged to find other women in the field. Now there are many women in the field, many women in general surgery. I think that the upcoming next generations have appreciated gender neutral, the importance of time in family, and importance of time for yourself. Right. And it's just totally part of the natural texture of career development.
Mm-hmm. Which is a good segue.
Are there any other aspects of the field that have changed in our field that you've noticed besides the development of the I-6 program, and anything else that you guys would want to share?
Well, technically, it certainly has changed from what were virtually exclusively open procedures. Now there is a wide range of interventions and procedures that take place. I think the field will continue to change, and I think that's one of the things that's attractive about it. It is not a static area of work. It's very kinetic. And I think that's why it's intellectually stimulating. It's creative. In my case, I also went on to have an administrative career as well as a blended career, blended clinical and administrative. I am having worked at managing a medical center at a very high level for physician leadership. I got to work in areas that were other than cardiac, and that kind of career development is totally possible in this field. And I would encourage people not to think about cardiothoracic surgery as just the medical work, although that's natural at the beginning of a career. As you go through your career, you can find all kinds of opportunities to learn. And it might be economics, it might be population-based healthcare, but there's a lot of opportunity in healthcare.
And there's enormous potential for research. You can find your little niche in research. It could be clinical, it could be basic science, and as Nora said, it could be population-based. And there is opportunity to expand not only just medical and surgical expertise, but also research.
I think just the whole, when we started out, it was kind of the oddity. There would be a woman in a department or a woman cardiothoracic surgeon. Not everywhere had one. But now I think the idea of in leadership is continuing to grow, getting professorships, moving up the academic ranks where you are. And I think it's not we don't know what to do with this person. Now it's you're part of the practice and you have fundamental important roles. And I think that's been a big change over my career.
And with the increasing number of women in the field, there's more women to mentor. So I think that's been very important.
And to network with.
Yep.
I mean, a bunch of us will all call each other and say, hey, what do you think about this and what do you think about that? And I think that's been really helpful.
So, any final words?
We think they should do it. But.
Yeah.
Everybody should.
Don't hesitate.
Yes. And if you have questions, please free to call us and chat with us, email us. We are all on CTS.net.
Yep.
You should be able to reach us.
And that's really common. People will call and email and say, talk to me about this. We talk to a lot of people, and that'd be great.